everybody, it's Medical Monday.
Correct. And today we're going to be going over thoracic pain. That's the mid-back region, because about 85% of people are actually going to have back pain throughout their life. And the mid-back is a very important region, sometimes overlooked.
It is overlooked. A lot of people don't even realize that they're having mid-back pain. They think it's coming from somewhere else.
Yep.
So
some of the issues that you can get mid-back pain are usually from trauma or injury. But of course, there's disc within there, so we can have some disc issues. Another reference to the mid-back pain is
injury.
Dr. Gappy talked about not knowing that you're having back pain. There's a study from the University of Bern talked about it was about 40% of people that go to the ER, 45% of people that go to the ER thinking they're having a heart attack. It's actually something else.
Yep.
And one of those something else is mainly the mid-back pain.
The mid-back, ribs mimic that all the time. Yep. So you talked about herniated disc. We also have injuries, right? Very uncommon. Our ribs actually protect our mid-back. We're going to hit on that here in a moment. But, you know, a lot of times traumas will significantly affect our mid-back. Something even, you mentioned heart attack, right? Open heart surgery. They open up that chest and get access to the heart itself. So traumas in those instances as well. Yeah, absolutely.
Trauma and compression fractures of the mid-back are one of the most common mid-back traumas that you'll see.
Very true, very true. And then also tumors, some type of cancer. They're called space-occupying lesions, where there's something growing in that area that's not supposed to be there, and so therefore it actually causes issues and different aspects there. So yeah,
unfortunately, that's how some cancers are caught. Is patients will complain about back pain, whether it's mid or low back, and you know, doing some lab work, doing some good workup, doing good investigative skills, refer or find these conditions. Unfortunately, sometimes a little bit too late, but
yep. And you mentioned that 80% of the population is going to have some type of low back pain, or
85.
80, you know, some type of back pain. To be more specific, there, 20 to 40% of the general population at some point in their life is going to have something called slipping rib syndrome, or have a slipping rib syndrome episode. 20 to 40% of the general population is going to have this. You know, and a lot of people don't even realize it.
Is that where the rib slips out of your hand?
The rib.
When you're trying to eat it?
When you're trying to eat it? Maybe.
No?
Oh.
Okay. Maybe not.
That was a good one.
I was trying for it. So a slipping rib, though. Explain what slipping rib actually is.
So slipping rib actually, we're going to hit on the anatomy here in a moment, but the rib actually is a joint space that connects to the spine itself, and there's a joint space or a capsule that exists there. And so what happens is that rib, as we breathe, it expands, and then as we inhale, exhale, it expands, and then it releases. So sometimes we can, I've had a patient actually come in. She said, I was washing my hair like this, and then I sneezed, and my rib popped out. So like slipping rib is when something happens, typically breathing related, and it pops out, similar to what's the word I'm looking for?
It's like a dislocation.
Yes, a dislocation. Thank you. I couldn't think of that word just now. Similar to a dislocation, but typically not as bad. And so that's what a slipping rib is.
They're designed to move. Your chest is a cage encompassing from your ribs. You know, they connect to the front, your sternum, and of course your back, where your mid-back is. But that's a protective area, and they're designed to move. Your chest moves when you inhale oxygen, and of course it moves when you exhale oxygen. So that's kind of designed to slip a little bit, but when it goes too much and starts causing discomfort, patients will notice.
Yes, they will. And you will know if you've ever had one. And then, we're talking about traumas, we're talking about different things there. There's acute, which means it's freshly happened. It's something that typically, just happened or is within a few weeks old. And then we also have chronic. This is something that I've dealt with for years or for months. Chronic means that it's existed for quite some time. Typically in the office, we end up seeing probably a good combination of both, to be honest. When we talk about acute, somebody's hurt themselves, they want immediate help. But then, sometimes people give it the 7 weeks to see if it heals on its own. And we see them later in life. When there's
you see a big spectrum, because there's a lot of patients that are very active. And that's one of the things you want to focus on with all type of back pain, is to maintain activity. So, patients come in, and say you're playing basketball, and you get hit, or playing football in the backyard with the kids or your group of friends. Accidents happen, and that's where we see some of this mid-back pain. But she talked about where's the acute level, which means it just happened. Like this weekend, we were playing and I tweaked something, versus, I've always had this. I've had this back pain for, 12 plus weeks, or, a lot of patients talk about I've had it for years. What really differentiates those two beyond the time difference is there's what's considered maladaptive coping mechanisms. What that means is if somebody has acute back pain, they do something this weekend playing football with their friends, if they stop doing activity, that's the #1 predictor that that patient's going to now have chronic back pain because they stop doing activities. You want to continually do activities even if it's at a decreased level so that your acute back pain doesn't turn into chronic back pain. Nobody wants to live with back pain forever.
Yeah, and no, you know what nobody else wants to is not do the things that they love doing because of something they've done before. Absolutely. You know, we've hit on a lot of things. We've talked about a lot of anatomy. So now let's show everybody.
What is this?
What are we talking about? So, you know, we do a lot here with the spine. And with that shared, we have 4 regions of the spine. We have the neck or the cervical region. We have the thoracic spine, which is what we're talking about this week. All right, that's the longest part of the spine. It's 12 vertebra. All right, and then we have the low back here, the lumbar spine, and then the sacrum. All right, so those are the different regions of the spine. They all have different uses. And with the mid back, we have ribs that come with that. Sorry, Lonnie, I had to reposition so I don't fall off my chair there. So we have the thoracic spine here. You can see the ribs coming off. Yep. All right, and then believe it or not, the shoulder blade. The shoulder blade is part of the mid back. There's a huge correlation between, you know, how the shoulder moves, how things work, and then affecting the mid back there. So if we have any shoulder injury people out there, you know, there might be some residual effects in the mid back, or people that have mid back issues, it might be coming from your shoulder. We see this all the time. We truly do. We truly do. Some other things you talked about was the sternum, right? We have a front and a back, right? This is the back side, all right? This is the mid back here. You can see the ribs, the shoulder, the shoulder blade itself, the clavicle on the front, all right? And this is the front, all right? So we have the sternum here. This is what they cut open when you have
breastplate right here.
Right here. So when you have open heart surgery, this is what's got wires in it right now. You know, so there's a lot of different moving components. This is all designed to help protect major organs and then also allow us to breathe more efficiently. There's actually muscles. You know, we talked about ribs. There's muscles between, there's meat between these bones here. That's just like ribs that we eat.
Yep.
Nom, nom.
Exactly.
Yep. And then also, we talked about muscles. There's different layers. Just like ogres, believe it or not, just like ogres, humans have layers as well, just like onions. Okay?
Just like onions.
Yes, ogres are like onions, so are humans. Humans are like onions, and we have different layers. So we have superficial layers, we have deeper layers, and believe it or not, there's even deeper muscular tissue that exists.
But that model right there, Dr. Gabby, really illustrates how the muscles are connected.
Yes.
So those muscles that move your shoulder are connected to your back. The ones that move your back are also connected to your shoulder. Mm-hmm. They work hand in hand, and it's very complex. Yes. So sometimes when patients come in with mid-back pain, it's from some other issues, some trauma with multiple different tissues back there. So it's very important for us to find out which tissue is actually damaged so that we can work on that particular problem.
Very correct. You know, finding the cause is the most important thing when you come into the office, which is typically why we tell you to come into the office so that we can figure out what is going on. What is going on? So we've also talked about different reasons or different things that happen to us that causes mid-back pain. And so, you know, there's a lot there. There's a lot that exists. We talked about this. You know, the herniated discs, degenerated discs, infection. We didn't even hit on that a moment ago. Infections happen. We have, our lungs are here, our heart's there if you've ever had an infection, compression fracture, and then cancer, tumors, things like that. Absolutely. And I wanted to make sure that everybody saw this. The rib is one of the biggest things that causes issues in the mid-back. This is a close-up and a kind of a dissection per se of a rib. So this is the spine that you see here, all right? And this is actually the front of the spine. This is the front of the spine, all right? And this is from the side. So you can see that joint capsule that exists around the rib. And what this does is it expands as we breathe and releases as we breathe. So if that were to move up too far, move down too far, move back too far, move in too far, you know, there's a lot of movement or, you know, places it can go when things don't work properly. So this is what a rib joint looks like with a joint capsule around it.
Oh, perfect.
Yeah, and that is a very common cause of it. Also, disc herniations. This is very uncommon, but typically when it does happen or it does exist, you know, people know pretty quick. So this is what a disc herniation looks like in the mid-back. You can see here, this is the spinal cord.
So explain a little bit what kind of image this is, Dr. Gay.
This is an MRI. This is an MRI. So we take x-rays to see skeleton, or our skeleton, our bones. For MRIs, we take MRIs and CTs to see different types of soft tissue, which would be ligaments, tendons, or muscles. We can also do it for organs, but we don't do that here in this office. So
those ligaments, tendons, and muscles, those are what connect all of these bones,
yes,
all these joints, all these muscles together.
Yes.
They can have some inappropriate forces causing this herniation, right?
Correct. You are correct. That is 100% there. And what happens is, we talked about space occupying. It doesn't have to be a tumor. It can be something like a disc herniation. So this should be very smooth, like you see it in the front. But if you look right where this is, there's a herniation there. There's something pushing on the spinal cord itself. And so that is what a disc herniation looks like. That's what it looks like in the mid-back as well.
Yep.
And then a compression fracture. The example I like to use is a can. We've all seen a soda can before, or a Coke can. I'm from Louisiana, so a Coke can. So with
Dr.
that,
Pepper can.
a Dr. Pepper can. No,
Texas.
That's Texas. Yes,
Yeah.
I was like, everybody. So with that, it crushes. That's literally what happened. Is the bone gets soft and brittle, and it crushes. It's very uncomfortable. There's a lot of procedures to help support that. If it does happen, doesn't heal properly, but a compression fracture is quite common in the mid-back. Yeah. And then also we've talked about the different types of degenerative disc and things like that. So this is somewhat of a progression here. We've got a normal disc. This is just a degenerating disc, a dehydrated disc. It's going to thin out. It's going to degrade essentially. We have the disc bulge here, where the disc itself is still intact. It's still a capsule, but it has a herniation similar to like an umbilical herniation, things like that. Then we have the herniated disc itself. So a herniated disc means that the contents of the disc are popping out and pushing on something. A thinning disc, similar to the dehydrated disc. And then also just, can't read backwards, disc degeneration with osteophyte formation. I got even fancier with that word.
So that decrease in joint space happens because the disc is very happy up top. As that disc deteriorates, those bones do not have the lubrication and the movement that they need. And actually, that's the #1 cause of it. There's numerous studies, especially from, let's see, this is the scientific report that noted the positive effects of exercise on the disc metabolism. What that means is the fluid content needs to be very healthy, and it only happens through exercise and movement. So we actually need to move our backs more instead of less.
That is very true, right? Because typically what we do is we don't want to use it because it hurts.
Yeah.
So,
if it hurt you to garden, and I know you got a garden this year, you just stop doing it.
You just stop doing it.
But that's not a good thing to do. You need to do some movement so that you can get back to doing those activities so that your disc, as we see, doesn't go down this cascade.
Correct. And this is a model we have here in the office to show. You can see this is not clean. This is very rough. You can see even here, there's pressure on that nerve root that's there. This can happen at any level in your spine, but with that, we need to introduce movement so that we can get a better, healthier vertebra segment there. There's a lot to it.
Motion is lotion with all joints. You need to utilize those as much as possible.
Very, very true.
And whether it's, some people have home activities, some people are runners or activities at the gym, or they're swimmers. Those are great activities. But then there's other people that get a lot of activity just from work. So work is, kind of just like other activities. They're dual problems because they're good and they're bad for us sometimes.
Yep.
So running's great. Sometimes we overdo it and we have an injury. Or working. Sometimes we're in a good physical job where we get good exercise. But, if you're doing a little bit too much and you have some injury, that is a problem, but it can easily be fixed.
Yeah. And so what are some things that we can do at home, Lonnie? What are some things that we can do at home to, I've tweaked my back, I've done something in my mid-back, how can I help myself?
So first and foremost, we want to maintain activity, but we got to do it at a nice steady pace. We always use the acronym RICE, which stands for rest, ice, compress, and elevate. And we have a little handy picture here to help with it. The pig is very restful. You want to do that. You want to initially give it a little bit of rest and then start slowly progressing back into activities. With all initial acute injuries, you want to utilize ice. Ice is very good at help kind of bring down that inflammation or the swelling and the initial pain. And then compression. If there's a way that you can compress that area, whether it's through a wrap, will help alleviate some of the pain. And then, of course, elevate. I wouldn't elevate like this kiddo here, but
I
they're very bendy. So
They
this Gumby kid over
Yes.
here is making us look bad. But no, you want to do that first step is rest, ice, compress, and elevate.
Elevate, absolutely. Yes, and that's always, the mid-back is actually one of the easiest regions of the spine to compress. It definitely is, because the ribs help to protect everything, and structurally it's a very beautiful support. It helps, and it's very, very comfortable.
Yeah.
And so what are what are some things that mainstream, what would be like, I went to my doctor, my mid-back hurts, I went to my doctor, what's going to happen there?
So before you go to your doctor, about 70 to 90% of people are going to get better on their own.
Mm-hmm.
So with their home treatments, with their rest, ice, compress, and elevate, they're going to get better.
Mm-hmm.
But then even the Spine Center of Boston, they've noted that physical therapy, which you could do at home, there's multiple Google searches for back stretches. It doesn't risk injury, and it doesn't risk work abscess because it helps you get back to work faster.
Mm-hmm.
But if you've tried those and you're still having problems, some of the common things, unfortunately, that you see when you come to a primary care, such as what you would traditionally do or an urgent care, you're going to get medications. You try those at home. You try what you can get from Walmart. Try your Tylenol, your ibuprofen. But then if those are not holding you, then you come to your urgent care, primary care, mm-hmm. and then what help is given there is the only options that we have. Mm-hmm. A lot of times, the options that we have are told to us and explained to us through the big pharma. Now, there's multiple reps that come through and tell us about these great new medications, these great new pills, and that's what we utilize. It's what's in the toolbox because it's what we know alleviates some of the pain. Mm-hmm. But what's causing the pain is not a lack of medication. So masking the symptoms is not always helpful, unfortunately.
Yeah, that's very, very true.
Some of the other things, we go down there, if pills are not holding your pain, there's steroid injections. We can do injections to either help calm down the nerve or injections to help wherever the muscle spasm is. Those steroid injections are more of a commonplace. Mm-hmm. And of course, there's limited how many you can do per year just because of the side effects, unfortunately, that they have. But if the steroids are not controlling your pain, then the next step is we're going to have to go towards, let's see if we can either clean out some disc space or if we're going to put some hardware in to lock it down.
Yeah. Because
the movement causes pain for patients. And the last step, unfortunately, is just to lock it down with hardware.
Yep. That's very true. And we actually see quite a few patients here in the office that have hardware in their mid-back. It's a very common treatment for scoliosis, and it was in the past, a little less common now, but it still exists. Yep. And mid-back hardware is very restricting when we talk about just the effects of that. So we try our best here and just in general to make sure that we avoid that as best we can.
All surgeries, they have their place, but if we can prevent them, if we can start at if you remember the picture earlier of the spine where the healthy discs were up top and it kind of cascaded down, the sweet spot is always further towards the top instead of down to the bottom for all treatments.
Yes. Keeping it healthy. Yep. So what are some things that we can do here in the office? The different regions of the spine are all different, right? They all have different uses, different movements. So tell me more about what we can do here in the office specific for the mid-back. What are some things we do here to help?
So there's a few things, rehab is always great. You want to exercise and utilize those muscles, but we also offer a couple different injections to kind of help those muscles relax. Mm-hmm. All right. I don't know which one we got.
Yep.
So the first one is a trigger point injection. So a trigger point injection that we utilize here in the office or help to melt those muscles like butter. Sometimes they will lock up because of the disc malfunction, the disc herniation. So they want to lock up and hold that vertebrae so it doesn't move anymore. What we want to do is we actually want to relax those muscles. We do it through all natural solutions. There's 2 medications that we utilize that are just for comfort. And those are like when you go to the dentist and they numb your gums. The third one is actually Tramiel. That's an all natural 13 botanicals mixture that's a natural anti-inflammatory. So it's kind of like natural liquid Motrin injected right into the muscle.
Right into the muscle.
Right into the muscle.
I like it.
And then we also have some other options. We utilize what's called platelet-rich plasma. And this is your own blood. What we do is we draw it and we concentrate it down because your own blood has platelets in it. Platelets are important because when you cut yourself, platelets not only stop the bleeding, but they also start the healing process. So with that, we want to actually concentrate those platelets and put them directly where the damage is within that muscle or soft tissue around the back, the mid-back problem. Because it's not just the spine that's having problems. Those muscles that hold it are also having problems.
And I'm going to put you on the spot here for a second.
Go ahead.
Of the patients that we see here in the office for back pain of all different types sorts, what percentage would you say get TPIs?
A large percent of them. A large percent of them. The office like this, we specialize in back pain and sciatic pain, and most patients, thankfully, they come early. So we have acute patients. So there's an injury and there's a muscle that's tweaked, and trigger point injections and platelet-rich plasma injections are very good for acute injuries. Now, some of the chronic patients, say somebody has been somewhere else or just kind of not been taking care of it, still come in the office with these pain and problems. We have a spectrum. So, you know, the trigger points are great for your early patients. Your platelet-rich plasma is great for your chronic patients. So that provides us the spectrum to really be able to help any patient that comes within the office.
That's wonderful. Very, very cool. Thank you for sharing that. You know, and one of the things you mentioned was rehab, right?
Yes, very important.
And so just about, if not all of our care plans incorporate some type of rehab, because typically injury was due to, you know, either some kind of weakness that exists, or we need to correct a weakness that could exist in the future. So we need to make sure that we utilize that. And, you know, like I said, just about every patient that goes through an active care plan of some sort,
Must do rehab.
Yes, we've got to focus in on those muscle groups and make sure that those joints are stabilized through proper use of those muscles.
And remember, the #1 reason why you have chronic back pain when you started with acute back pain is because you stopped doing activities.
Yes.
So we've got to calm down the inflammation, but then we've also got to strengthen those muscles. Muscles need to be flexible, but also strong.
Very, very true. Very true. And so we have specialized equipment in the office to help hone in and focus on those specific muscle groups, whether it be for the shoulder, you can see the TheraBands here, or the low back and mid back in regards to the wobble chairs, making sure we focus in on those joint groups.
I love those wobble chairs. They're very good for disc rehydration.
Yes.
And that's that mobility of the disc so that the metabolism and the fluid within that disc is very healthy.
Yep, and that's one of the home exercises we give patients here. Yep. And then you talked about disc rehydration, right? Spinal decompression. Even though it's the mid-back, we can still stretch out those tissues. We can still focus on those herniations in the mid-back with the spinal decompression. So, you know,
they're all connected.
All of it's connected.
All of your spine's
so we
connected.
need to make sure that we stretch it out and rehydrate those discs and work and support those tissues so we get the best movement, the best function that exists. And what I love about our decompression versus a lot of the other ones that I've seen in my years of practice is this one incorporates other therapies, vibration therapy, heat therapy, and then it has different settings to open up those joint spaces in different directions. So it is a phenomenal tool to have.
So the heat though, the heat and the vibration, how is that specifically helping the patient get better?
That is a phenomenal question. It really is. So with that, you know, what is it about the heat and the vibration that helps? It increases blood flow. You know, you already mentioned with the PRP example, right? With the white blood cells is what it heals our body. When our body cuts ourselves, we don't always need stitches. Sometimes the body just scabs over and heals, which is great. Those white blood cells go to work. So it's the same thing when we increase blood flow to the area and it stimulates the area, we get better healing to that area. So that's exactly why that's incorporated in there, so that we can increase blood flow, increase nutrition, and get the effects that we need there. So wonderful. And then also chiropractic adjustments. It's very important that we support our structures. You know, we align our tires on our car all the time. We rotate tires, align our car, because if we don't, it'll shake, or we'll have to replace our tires sooner than we want to. So with that shared, it's very similar. We can't rotate our spine. We can't replace our spine. And so with that shared, we need to make sure that we align things and make sure we have a very great mechanical function there.
And you talked about the alignment, especially with your car, you know, and with the activities that we do, or just throughout life, say we're playing basketball or we're running, we're doing these activities. If you're not functioning very well, it's kind of like the tires on your car. They're just not aligned. That's part of the chiropractic care, so that you can get back into doing those activities. Or say if it's at work, if you're at work and you're needing, you know, you're doing physical things at work, you're going to feel it. Things are not moving right. You're going to have pain. There's going to be discomfort. And just as much as you would take your car in, you know, it's get a look at what's going on and actually align it and fix the problem.
Yeah, because sometimes it can be more mechanical. There's always a soft tissue component, which is why we do the rehab. But when we work all of it together, it allows everything to work synergistically. It allows everything to truly do its job and its function correctly and support it.
Yep.
Right? So because if we could get the soft tissue, muscles, tendons, and ligaments to work, and we can get the structures to be in the proper place, and then we can have things functioning correctly, then everything will heal faster and work faster and be faster. I mean, we have so many resources, you know, even with the adjustments, we can do manual adjustments, which was what the picture of the table's for, but we also have tools. Some people don't want to be adjusted in that manner. They don't want to
snap, crackle, pop.
Snap, crackle, pop. Such a professional explanation of what happens there. But yes, the adjustment is such an important aspect, and there's so many different ways to actually, you know, make that happen and make that a reality. So yeah, no, this is.
I like it that you have the different options. You know, some people need that physical table to where the chiropractor can get a good physical adjustment. But if you're worried about that, if you're one that, you know, is told or just worried about the snap, crackle, pop, there's other means. You know, the chiropractors can utilize the instruments to get a great result without having that fear or discomfort. Some people just don't want to have that, but that's great with the other options. I like that you have that.
No, and it's very important, right? Patients, you know, we're all human. We all want to be supported through processes. We want to be respected. We have likes, we have dislikes. And so it's very important to support patients through that process. And I think that as a team here, we are phenomenal at that and making sure that we support patients through that. So it's a very important aspect.
Well, I'm glad we got together this Medical Monday. We talked about some good thoracic pain, you know, what causes it. Unfortunately, some of the treatment options and the great treatment options, good and the bad with everything, so you can see and make good decisions. But know that thoracic pain doesn't have to be forever, okay? It's about getting out there and being more active.
Yep.
Hope y'all enjoyed this Medical Monday. Dr. Gab, you got anything else?
I do. I think we should get ribs for lunch today.
Let's do ribs for lunch.
Yeah. All right.
I'm on board for that.
Yes.
See you guys.
Bye, everybody.